Good morning. My name is Ben Panter, and I'm the founder and CEO of Blackford. And thank you for joining our session on what's holding back AI. So I suspect you're all familiar with the Gartner hype curve. It talks about any innovation in no matter what field, that initially there's some trigger, there's some innovative activity, and we get to the peak of inflated expectations. This is where the belief is that the product can do anything, can be anything, will solve every problem we have. Then there's disillusionment when we find that reality doesn't quite match that, but then we move up the slope of enlightenment to productivity. And I think it's fair to say that for most of us, AI is still at the left-hand edge of this diagram. And when we talk to our customers and we ask them, what is it that's holding back AI? They ask us, well, how do we navigate the market? How do we measure the potential of AI? And how do we realize that value within our environment? Now, in this presentation, I'll expand on each of these factors and how Blackford helps our customers to address them. So first, let's look at navigating the market for AI. Now, rather than starting with whichever vendor happens to be shouting loudest that day, we passionately believe that you need to start with the challenge that's most important for your practice. And that's different for every practice. It might be radiologist productivity. It might be modality utilization. It might be increasing value for a referring physician, or there might be some health system-wide population health initiative that you're being asked to contribute to. Now, these are all clinical challenges, but behind all of them is a business case for adoption. We're all in this hall because we care passionately about patient outcomes, but we also realize that our hospitals, our practices, aren't going to be able to integrate technology unless there's a valid business case behind it. So we need to focus on both the clinical challenge and the business challenge. So this slide is a couple of years old, and in fact already several of the companies on the list have either disappeared or maybe are on life support, I'm not sure. Some of them don't even sell AI. And it remains a complex and evolving market. Unless you're fully immersed in this field, it's very hard to separate what's real from what's, well, often very well funded noise. And you might have picked the condition that's most important to your facility, but how are you going to find a solution? So here we're starting to get into how Blackford helps. So we've done the research up front so you don't have to. These are all the FDA and CE marked AI applications available in the market. You can see that I've timestamped it November the 20th, because this information changes all the time. So great, we've got another list. Well, Ben, you could go to the ACR, you could go to the Grand Challenges, you go to the FDA. All of those have versions of a list of different ages, different provenances. Well, we keep this live because we have to, because our customers respect that we're whole of market, that we see all of these companies, whether we have an existing relationship with them or not. We try to be entirely neutral in our research phase for the navigation piece. It's also nice to have a whole wall of logos and pictures up there, but it's not actually that useful. What you need to be able to do is to understand what modality vendors do these products work with, what age of modalities do they work with, what's the imaging protocol, and does it fit with my existing practice? We look at the acquisition protocols, we read the 510K submissions, we talk to their customers, we perform vulnerability scans on containers. Cybersecurity is a massive issue now. And fundamentally, we've often already deployed one of these applications in one of our sites. So if you don't have the resources to deliver all of that kind of research and keep it up to date, and I don't know of any group that does, you can work with us and we'll help you have that. So let's go in on one clinical condition as an example. So let's pick intracranial hemorrhage. So again, this is the November 20th timestamp. There are 17 vendors out there who have an intracranial hemorrhage solution. And let's be clear, these are all regulatory approved, they're all good applications, but actually there may be some that work better for you than others. We'll come on to that in a moment, but I'd just emphasize again, we're whole of market. We don't have our own solutions that we're trying to promote and push against something that might work better for your environment. And we'll give you that honest, unbiased view of what it is that would suit your clinical challenge and help you look at your business problem. So, navigating the market. This is the summary of what we do. We've got the widest range of pre-integrated AI applications of any platform or marketplace. Now, not only that, but we enable any new application to be onboarded quickly and to be available through our platform and do everything else. And that includes the algorithms that you're developing in your own hospital. We help you make sense of a very noisy market, and we weave together combinations of vendor products to solve your clinical and business needs. So let's move on to that next step. We've got a set of candidates for AI solutions to a particular problem. How do we measure the potential? How do we know that they're going to work in our environment, with our data, and they're going to deliver results that are useful for our clinicians? More importantly, how do we know that the business case we built to adopt that technology actually stands up? Okay, if you want to do this yourself, for each of those 17 solutions, you're going to need to evaluate the product, you're going to select the product, IT approval, internal business case, legal and the BA, purchase approval, hardware and infrastructure, deployment, training, get it out there, do the analysis, run the test. It's almost impossible. You know, this is a year-long process for you to do this at your facility for each product. Trying to do it with 17 is just impossible. So how do we help? Well, we run the trials for you on your data, in your environment, behind your firewall if that's what you want, or in the cloud if that's easier. We help you with the trial design, help you understand, well, you understand the clinical problem that you're trying to solve, but let's think about what the candidate solutions are and how we test that. We help you evaluate whether the business impact is there and what the business impact you'd expect to get from AI. Then we help you gather the studies. So we have a platform we deploy in your practice. We can pull that data in, do batch trials, etc., etc. The key thing is that this is with your modality data, it's with your patients, and it's in your environment. Then we help you do the processing. You don't want to be having to stand up all these different algorithms, run this through there, run that through there, compare all the answers, bring it together. We can do that on-premise or in the cloud. It's entirely your choice. We can recruit your chosen candidate vendors. So if they're pre-integrated into Blackford, that's easy. There's relationships already in place with all of that. If there's other vendors that you'd like to trial against it, very happy to work with them. And in fact, we've successfully done that multiple times now. So then we do the analysis. And in fact, we produce reports that show the clinical performance and the business impact. I think it's more meaningful if I show you an example in real life of one of these projects. So let's go back to ICH. We have a large distributed teleradiology practice that's reading studies across 4 time zones. There's several different PACS vendors that are feeding a single PACS and an overlay worklist. So we've got to be able to pull all this data that's coming in a lumpy fashion. There are bursts of data coming in. There's lots of different modalities, lots of different protocols, lots of different study labeling. And the business goal was really to add AI-based detection to reading workflow to improve accuracy and average turnaround time on positive exams. And you can see the AI challenge that we were trying to address there as well. So why is it really important to understand the customer's business case? Well, I mentioned that there were 17 solutions out there. And to be clear, none of these are bad models. They all have different strengths and weaknesses. And there are different decisions that have been made when they built them as to which particular areas they're interested in solving. So there's a risk that I show a chart like this and everybody falls asleep, but hopefully you'll bear with me for a minute. So one of the ways that we can compare AI models is sensitivity and specificity. And fundamentally, what we really want is high sensitivity and high specificity. That means fewer false negatives and fewer false positives. However, the reality is that often you have trade-offs and you have to choose one direction or the other. Again, there's no bad models out there. It just depends what the use case is for you. So intracranial hemorrhage is an example. If you have a lot of false positives, you're going to burn a huge amount of radiologists' time trying to chase them down and understand why the AI said that and really be absolutely certain that this isn't a problem for your patient. And if you're in a busy teleradiology practice and you're fighting against turnaround time all the time, that's just burning into productivity. On the other hand, if you've got a false negative, you may in some cases have a patient that goes through that process. The radiologist hasn't caught it, the algorithm hasn't caught it, it's not going to be a great outcome. But depending on the business needs of the practice and the patient population and everything else, you might fall into one or the other of these categories because you can't have both. So let me populate this with data. So I've jiggled the points around slightly so I don't embarrass any vendors. If you want to do this work yourself, you just pull down the 510Ks of each of these 17 products, or I don't know how many I've got here, 6 products here. And actually you can see the sensitivity and specificity. The algorithm's fixed at that point of the release. And when we plot that, you can see that there are some that fit the high sensitivity, good specificity bracket, some that look at good sensitivity, high specificity. Unfortunately, there's none that are in that Goldilocks territory. It's important to note, though, that this is on vendors' own data. And they're different data sets. There's no universal calibration set out there. What you want to do is see what this looks like on your data, with your artifacts, with your modalities, to be able to understand for your patient population what's going to be the best solution. So Andrew Ng, I think you're probably all familiar with this quote, effectively saying that it doesn't matter whether the model performed brilliantly at that hospital down the road. What you need to care about is whether it works in your hospital with your patients. So if we run here a trial on 400 studies at this site, we can see that actually some of the points move around. I'd note that some of the points haven't moved around because those vendors chose not to participate in this trial. We would never do this without vendor buy-in, but sometimes vendors feel a bit concerned about that. We would respect that. But you can see where the changes are coming, and that it's important that you understand this for your data. And it's important that you can see across the whole of the market, because each of these individual vendors, they can't change that algorithm. Once it's set, the 510K is in place, you don't have the opportunity to recalibrate, retune a solution, make it do something slightly different. Unfortunately, that's what you're stuck with. I mean, you can do things under an IRB approval, but it's not really an area we want to play in, right? That there are products that have regulatory approval, that's what you should be using. If you go with a vendor that has one algorithm, you've only got 1 point on this chart. If you go with a platform like Blackford, you can access all of it. Okay, second example. Where actually the majority of trials we do are not about comparing two vendors or multiple vendors. They're about checking whether the business case for adoption is realized in the facility. So here we've got a customer that wanted to do chest X-ray escalation. I think they read 3 million studies a year at this particular radiology practice. And they're really interested in optimizing the order of chest X-ray reading. So they wanted to check for abnormalities and make sure that if there was something, that got to the radiologist earlier. They're also a big site. They needed to make sure that that particular aspect of the processing could go at 2,000 exams per day. So we ran that trial. Turns out that they wanted to be able to escalate 70% of studies. The vendor that we were able to offer could do greater than 80% of studies. So that's things that the customer had previously identified as findings that were missed. They wanted to make sure those were escalated in the work list and got to quickly. You can see on the right there, speed testing for resource. Is there enough resource? Because oftentimes we don't really know how well an algorithm is going to perform until we've got it deployed. And we need to make sure there's enough resource there for it to run and deliver results in a timely manner. So we can show you several other case studies on the booth, but really, this measure the potential piece is absolutely critical for the adoption of AI. Here we're looking at the huge task, and can we help you run that on your data? So realizing the value, we've navigated the market, we've measured the potential, we've all deployed products that looked fantastic and actually haven't really delivered on the promise. Okay, I'm just going to scoot through here. We're integrated into all the elements of radiology IT workflow, the EMR, the modality, the work list, the archive, the viewer, reporting, clinical comms. We focus on augmenting workflow rather than replacing it, so working with your existing systems. And by all means, come and have a chat with us on the booth to discuss that further. So just in summary, we are the originator of the AI platform. We're the longest established platform and marketplace for AI. We've deployed more third-party applications than any other platform. Our live servers see 30 million studies per year, and we serve over 750 clinical sites across 4 continents. That's how we realize the value, and I'll just leave you with the navigate, measure, realize messaging, and invite you to come over and meet us at our booth. So thank you very much for your time.